Dr. Renee. And as you know, we're here every Thursday. And I told you guys last Thursday, we are talking about Colon Cancer Awareness Month, which is the month of March. So today I'm so excited. We have a gastroenterologist who is beyond amazing. All the things that she's done. When I read her bio, I was blown away. And at the 11th hour, you guys, I found us a patient. I am so excited. Gwen and her family were on Family Feud last night, and that's how I found her. But please share this broadcast. I'm so excited to see so many of you have come on already. Please make sure you type in the chat and let us know where you're tuning in from. And I know we are on Facebook, we're on YouTube, and we're on LinkedIn. Please make sure you share the broadcast because this is important information. Black people are dying at alarming rates, and Dr. Lassiter, I'm sure, will tell us what these rates are. But it is really sad how young we are getting. We're getting colon cancer and dying. So, thank you so much, and I will bring them on. Hi, ladies.
Hi. Hello.
So I forgot to ask, you want to go by Dr. Lassiter or Dr. Janese?
Doesn't matter. Whatever you got. Whatever's easy.
Okay, so we're going to start with Gwen. Please tell us your fabulous story. And I'm so happy that it is a great story.
Yes. So my name is Gwen, and I am from Memphis. You probably knew that from Family Feud. Yay. Too bad we didn't win, but yes. I've met a new friend, right?
Right.
So I was diagnosed in 2018. Actually, I know my date, November 9th, 2018. And probably for about a month and a half, I had experienced some rectal bleeding. Not a lot, just a little bit. When I would wipe, it wasn't anything to fill in the toilet or anything like that. But I knew that wasn't normal. I'd had, hemorrhoids in the past, but it just didn't feel, the same. I decided I was going to go to the doctor, but it was kind of odd because some of my friends were saying that I was losing weight, and I didn't really see that because I'm already small and my clothes didn't feel any different. I didn't feel like I was losing any weight, but I heard that from one too many people. And so I went ahead and scheduled an appointment to go and just see what was going on. And I was 49 at the time. So the doctor did not do a rectal exam or anything like that because I was going to turn 50 in January. So he just scheduled me to go to see the gastroenterologist. I went to see him and he did an exam, but and I guess Dr. Laster will know, you guys don't really tell the patient anything at that point, He did the exam and he said, yeah, I'm going to go ahead and schedule you for a colonoscopy. And at the time, so matter of fact, let me move back. So that was actually probably the end of October, because then my brother was getting married in the Dominican Republic. And so I told myself, well, I can go and get my colonoscopy, but I don't want to go right now, so, and he was so professional. He's like, just don't wait. You can go when you come back from out of town, in which I did. I returned to the States like that Monday. I went and got my colonoscopy that Friday, and they told me that Friday. It was, oh gosh, I remember that the rest of my life. He came in and he was like, looks like you have cancer. And I was like, oh gosh, you just don't want to hear those words, but I have to say it was, they told me it would be a year. So, and it was a year to the date that I went through my full process. So I started chemo in December. And from there, I talked with my oncologist and she was absolutely great. They just gave me everything that I needed. They said, look, you're going to do chemo, then you're going to do radiation. You'll have your surgery, then you'll have a temporary ileostomy, and we hope it'll be temporary. And if all goes well, you'll get it removed. And in a year, you'll be fine. So, but you got to commit to this year. And I did. So, December came and I told my oncologist, I was like, I have a cruise scheduled for January for my 50th. And she said, you know what? Do exactly what you're supposed to do. You go ahead. And I went on my cruise for my 50th. You know, I had already had two chemos infusions. So just to let you know, I was getting chemo every 3 weeks. And then the off weeks, I had a chemo pill. So I was taking chemo orally and through infusion. And so I did that through March. And then in, let's see, May, because you have to wait about a month to start radiation. I did radiation 5 weeks, started in May. And August, I had my tumor removed and I got my ileostomy. And you know, and it was definitely an adjustment. So I kept that for 3 months. And just to know, my ileostomy and my mom, and you know, we had a girls' trip with some more friends, went to Italy, ileostomy and all. And and so then in November, I got it reversed. And so from there, you know, then I started seeing my you know, I go to my oncologist every 3 months, but they just changed it. I go every 6 months now, you know. But what I have to say is, and what I heard from my doctors was that it's really your attitude. You know, I never decided to be defeated. You know, when I found out, and yes, I had that little mourning process, like, oh gosh, you know, why me? But it was just like that. And after that, I decided, I said, you know what? God put, you know, he just added some chapters to my life. Cancer is not my bookend, and it was not going to be. And yes, I had family support, but what I really liked is they allowed me to go through this process how I wanted to go through it. I never stopped working. I took myself to chemo. My daughter wouldn't let me go to my first session, and because the doctor said, you don't know how you're going to feel. So the very first one, I went with my daughter. I didn't allow anybody to go with me after that because I didn't want them to. I wanted to drive myself. I went to chemo, and after chemo, I went to work. And you know, radiation, I drove myself, you know. But then the last thing they did, they said, well, you can't go to the last one by yourself because we want to see you ring the bell. So I allowed my family to go with me, you know, that last time. But I appreciate that because they allowed me to move through this process how I wanted to move. And what I, you know, overwhelmingly heard, you know, from my doctors was it is definitely your attitude. And what I felt was I got to go through this process because cancer is not going to get me. It's not going to happen. So I stayed active. You know, I ate right. You know, and like I said, I'm not a big person anyway. So my fear was, you know, am I going to lose weight? Am I going to, you know, and I did not, you know, and it just, you know, I did a little research before because, you know, they told me what chemo I would have. And I was like, well, am I going to lose my hair? And that's my daughter's like, are you going to lose your hair? And she's like, well, Mom, if you lose your hair, we cutting our hair off too, you know. But I didn't, you know, the chemo that I had, I actually did not. So that's my story, Dr. Renee.
That's wonderful. And I think attitude has a lot to do with a whole lot of dis-ease, as they say. But so we have Dr. Janese here who's going to break it down for us. Please, first of all, I want you to tell the numbers, the current numbers for Black people and the ages.
Yeah. First of all, I want to say to Gwendolyn, thank you for telling your story. First of all, her story is so common and you don't understand. This is a gastroenterologist's worst nightmare when we have to come out and tell somebody that. It is the worst. You hate it. You put it off as long as you can. You sit in the room, you finish writing your notes, you send the message to the oncologist, you go ahead and order their CT scans, but you hate it. You waited for them to wake up, you have to have this family member come back there, and you absolutely despise it. Even when you sort of know what you're going to think, like that person, he probably had an idea. He probably looked at your labs, he probably looked at your symptoms and probably had an idea. I mean, we always have a little bit of an idea in most cases, but that is like the thing that you absolutely hate. It is the worst. So I'm so glad you had a good outcome. Your attitude is huge. Attitude, support, being able to do things on your terms, eating well, which is what I'm always bothering my people about, eating well, staying active, and mindset. So that is, I love, thank you for sharing. And I love your attitude because it is huge. Let's see. Now, from another thought I want to say about what she said that's super important is no matter how small your symptoms are, you have to let your doctor know. Because I can't tell you how many times I've had patients. And as you can see, she was not 50, which is that magic number that there used to be of, oh, patients over 50 get colon cancer. Listen, colon cancer does not read our books that we have from medical school, and it does not care. And when I was in residency and fellowship, I kept seeing people my age having diagnosed with colon cancer. And it freaked us all out because we were like, what is happening here? There are people that were saying, oh, it's just hemorrhoids. And then we would always say, well, how do you know if you've never had a colonoscopy? How do you know it's from hemorrhoids? How do you know it's nothing else? And so that's what that experience, my training taught me is it is not just hemorrhoids until somebody has looked in your colon to tell you it's hemorrhoids. So even if you don't have a family history, you still have to you have to be screened. You have to have somebody to talk it out to. Somebody has to do a rectal exam. Somebody has to figure something out. We have to be able to look if there's bleeding. So we'll start there. But the reason that recently the age was changed from 50 to 45 is because over the last 10 years, we have been seeing an increase in the trend of patients, the younger patients being diagnosed with colon cancer and being diagnosed at later stages. And so that's why it recently changed to 45. The thought is that it may change again because we're really seeing people younger and younger. And as everybody has saw recently with Chadwick Boseman, much younger than 45 even, right? So that still would have been something that would have been missed in his case. So family history is important too, but there's a lot that we don't really understand as to why. And the other thing is we see patients of color being diagnosed later. So as you just heard Gwendolyn say, I don't even have to ask her what stage she was because I know what her stage was based on what she just told me she had done. She had to undergo chemo, radiation, and surgery and had to have ileostomy. So I know right there she was not stage 1, right? Somebody that does not have metastasis. And so what that means is spread. So that goes outside of the colon walls. So once it's outside of the colon walls, when you have to do all the things that she had to do. So, and that's what we mean by having a later diagnosis. I love it when I go in and it's something that I say, oh, great, I got the CT scan. There's no other spread outside of the colon, meaning to the lymph nodes or to the lung or to the liver or anywhere else, because we know that person's going to be able to have a resection of their colon. They won't even need an ileostomy bag. They can be reconnected and they don't need chemo or anything. They have to follow with imaging and labs with their oncologist and come back and see us within a year to have a repeat colonoscopy, but it's a much simpler course, right? And so that's what we were seeing over the last 10 years as the data has shown us that not only is there sort of an uptick of patients being diagnosed at a younger age, there's also been an uptick of patients being diagnosed later. And that's a lot of times, I think, in our communities because of patients just saying, oh, it's just because of hemorrhoids, or, oh, it's because I wasn't eating great. Oh, it doesn't happen all the time. It's not that much. And then also not being really aware of family history. So I think those things are really important. And I think it's just sort of us, educating as much as we possibly can about sort of the procedure itself and it not being that sort of, invasive of a procedure itself. And it's not a harmful test and it's super easy to do. But that's sort of been what we've seen over the last, 10 years. And what we've seen is an increase sort of across the line, across the board in every single demographic, and especially in African Americans, people of color, it has been diagnosed later, which makes it harder to treat. And not everybody is as lucky as Gwendolyn. So if it's, too far spread or the disease is too bulky, you're further down the line, then it's not curable. We can try to, keep patients with us as long as we can, but it's not curative at that point. So that is sort of why it becomes more deadly in our populations because we are diagnosed later. And so that's what what we are out here trying to prevent and to try to get the word out about.
So everyone, I want you to make sure you understand that colon cancer is a curable cancer, but you have to find it early, which is why it's important for you to pay attention to rectal bleeding, pay attention and make sure that you know family history so you get your colonoscopy when you need to get it. So if you have zero family history, you should get it at 45. But if you have a family history, you have to get it 10 years before the person was diagnosed. 10 years before that. So we just talked to Gwen, and Gwen's children will have to have colonoscopies between 35 and 40, because she was diagnosed at 49, but we know because it was a later stage, she had it for a couple years. And so that is why it's so important to know family history, because you want to make sure that you tackle this quickly. And, you know, a lot of people like to be completely in the dark and in the clouds about things. And, well, if I don't know, it doesn't exist. Well, that's not quite true. That does not work at all. Knowledge is power. You know, especially with any cancer, the earlier you know, the more likely you are to survive. So, you know, it's much better that you pay attention to these things. So I want you, Dr. Janese, to please tell us, when you say good diet, please let us know those important things that should be in your diet for good colon health.
I love that question, because inevitably, let's say we do a colonoscopy and a patient wakes up and I've taken out 7 polyps. And I tell them this, how many polyps we taken out and how many we take out tells us when you need to come back, right? And every patient will say, oh my God, how many polyps? Oh, that's terrible. I'm so glad we took those out. But what can I do to prevent that? I'm like, I'm so glad you asked, right? And so what we talk about with diet is I sort of start my spiel with, everybody knows that you smoke, there's an increased risk for lung cancer. Everyone knows if you have excessive alcohol intake, it's increased risk for liver cancer. But what everybody conveniently forgets is sort of what foods have increased your risk for colon cancer. And so we know red meats and processed meats are the 2 biggies. And everybody sort of closes their ears and like la 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 when it comes to that, right? But we know they've been labeled as carcinogens and have increased risk for colon cancer. And so what do I mean by processed meats? This is when my dad gets upset and annoyed. But this is bacon. I'm from Alabama, so this is the problem. Bacon, sausage, ham, the pork, all of the deli meats that we eat. All of those, you know, those fake meats, all of the red meats, these are all things that we know are carcinogens. And even up to just 50 grams, a person that has 50 grams a day of those sort of processed meat has an 18% increased risk of colon cancer. 18%. Just, and you know what 50 grams of bacon is? 4 strips. That's 50 grams. 4 strips of bacon. And so just to give you just an idea. So those are the first thing, is reducing those, right? And so, and what do we want you to have? The average person. So we want people to get more fiber in the diet, more whole foods, more fruits, more vegetables. And so the recommendation for fiber intake is about 25 to 30 grams per day. And I always joke that everybody who's coming to me to talk about weight loss always talks about, you know, everybody's worried about how much protein they're getting. I'm like, y'all are not protein deficient, but I know what you are. You're fiber deficient. This whole country is. Everybody has constipation, abdominal pain, and bloating because they don't poop. And so getting people to get enough fiber is huge. And so, and why as gastroenterologists, we care about fiber, not only so you can have bath movements and go, you know, and poop, but it's also because that's helpful for your colon health. So the fancy word is colonocytes, but for the health of your colon, that's what it feeds off of, right? So that's what gives these fancy things called short chain fatty acids that are what feeds the colon, and why do they get that? From fiber. So from a fiber rich diet. So getting patients to eat more fruit, more vegetables, more whole grains. You don't have to be afraid of carbs. So our goal is to give you sort of nice, complex carbs, trying to get people off of the processed food and trying to reduce the meat intake. So especially the red meat and processed meat. So I try to get people to eat more fatty fish, because that's going to be good for your overall cholesterol health. And so fatty fish, lean things, no fried food, trying to get away from all the processed foods, the sugary drinks, the sodas, all that fun stuff. And those are sort of a diet sort of for good colon health. So more fiber, and getting rid of that processed
people to
food.
do fiber, because fiber removes the fat. So did you hear what I said, you guys? Fiber removes the fat. So if you eat fiber, it removes the fat. So then, hello.
It helps with weight loss.
Exactly. That is, and so that's why I drink my fiber in my water every day, all day. I drink it. So they say every meal you should try and have protein and fiber.
Yep. And I talk to patients about that in so much detail. And so the nerdy part of the reason why that works is it changes your microbiome. So that's those little bugs in your gut that are trying to live, that changes that environment there. And so, and what that does is, so I had a friend from fellowship who would always say, man, if I look at a cupcake, I gain weight, but you won't. How is that? So why is it so different? It's because of the microbiome we've created, right? I don't drink soda or do the processed food. She lived on soda. And so those bugs that you create, and so studies have shown us that it's depending on your microbiome, how your ability to break down and sort of use energy differs. So people are able to use energy more efficiently, meaning you're able to break things down and your body can dispose of it more efficiently if you have a particular microbiome versus someone else that has a lazy microbiome and decides they're going to we'll just dump it off in here. We're not going to do anything to get rid of this extra energy. We're just going to dump it in our liver. So people have fatty liver. We're just going to dump it right here. So you have increased abdominal fat. And so by changing your microbiome, you have less of a affinity to sort of gain weight too. So fiber is your friend, and it keeps you full longer because it takes longer to digest too. From a GI physiology standpoint, it sits around in your belly longer to sort of digest through. It takes longer, so you feel full longer. So you're not going to be eating all day long and not eating all that processed food once you have a big fiber-rich meal.
And fiber also lowers cholesterol.
Yep, it's beautiful.
So all these things that you could, all these weight loss, over obesity, high cholesterol, all these things can be fixed by fiber. And fiber is in, like she said, fruits and vegetables. I'm sure you've seen the commercial for Cheerios. Cheerios pushes fiber. And, we just came off a heart health month. And, Cheerios is like, get your fiber because it lowers your cholesterol, helps you have a healthy heart. So yeah, oats are great things.
Amazing.
And then we're not saying you have to be vegetarian or vegan. You just have to do things in moderation, and then you can have lean chicken and lean turkey, and there's other things. We don't have to have steak
every day. Yeah.
No.
There's so many patients that have it. They're like, oh, I have it 3 times a week. I'm like, that's a little. We can do. Come on, let's bring that back a little bit.
Yeah, and make sure you know portions, because this is a portion. The size of the palm of your hand is a portion, not, so the petite filet at Outback Steakhouse is actually too much. So FYI, so if you're not even getting the petite filet, you're probably eating like 3-4 days servings.
Yeah.
So
I often tell people that 4 ounces is the portion size. So when you go to these steakhouses or these big fancy places and they come and they are so excited to tell you, oh, guys, the special of tonight, guess what we have for you? We have the 16-ounce tomahawk. And everybody's like, oh, this is amazing. I want that. That is enough for 4 people.
I was going to say the whole family needs to share the tomahawk.
Yeah, 4 people.
So Gwen, what changes did you make in your diet afterwards?
Well, actually, I ate pretty well, you know. So I haven't had sodas in probably, 8-10 years. So wow. I wasn't a person that drank sodas, didn't eat a lot of fried food. So most of my food was baked. So I didn't have to change a lot in my diet.
That's good.
My diet, my ileostomy changed things for me simply because there are things now that I have to try to figure out how it affects my body, because I loved asparagus, broccoli. I mean, I ate those things a lot. I can't really eat those now. So I have, I work with a dietitian to try to help me. I actually asked my oncologist if he could refer me to a dietitian because I felt like I wasn't getting the nutrients that I should, simply because my body was not reacting to it, so where I didn't eat fried foods, I could eat French fries and it not bother me, but I would eat, broccoli and I'd have pain, so I just kind of, work with her and just try to figure out what I can eat, so I do smoothies, things like that. Not a whole lot, but try to get in, those vegetables and fruits and things that way, because I can't do a whole lot of cook now. It doesn't react well.
Gotcha. And I also wanted to make sure people understood exactly what a colonoscopy was. And what happens during it, because I will not tell. I couldn't believe it. I had a friend that was completely clueless. And I was like, you're an educated person. You had no idea.
People have no idea.
I had my first colonoscopy in November, you guys, and it really was not that big of a deal. I received all the directions. They emailed them to me and they were on the box with the prep, but I had all the directions. They said, if you have any questions, please call us. I made sure I understood everything, but I had to drink this liquid. It was 2 little bottles. I had to mix it with water. It did not taste great, but it wasn't a whole lot. And they tell you what times you have to take it. My appointment was first thing in the morning, so I had to wake up in the middle of the night to drink the second dosage. But like I said, wasn't a big deal. My appointment was on a Monday morning, so I couldn't eat Sunday all day, right?
Mm-hmm.
Yeah, so Saturday night was my last meal, and then Sunday all day I couldn't eat. All I could do was drink clear. Well, they gave me some options, so I just drank water, but you could drink there was some other options I could have drank.
Do Jello, popsicles, ginger ale, you could do Gatorade, anything that is clear, anything that is not red or pink to stain the colon. So yeah. Anything that is liquid. You can't do milks or creams or anything solid, but if it's like a see-through, you could even do black coffee because that's clear. That's considered a clear liquid.
Yeah. So so what I do, I've told my Black doctor audience before, I put drops in my water. The drops are, I have Orange Crush and Grape Crush. So, and they are 0 calorie, and they help me to drink because I drink apple cider vinegar too. And so that helps me to get that down. So I was able to drink that still. I just had, and I also drink cherry Starburst. So I made sure I didn't drink the red. I stuck with, and they said, mix it up, the colors. Okay, fine. Did that. So I just did it. I just couldn't eat all day Sunday, which I intermittent fast. So I haven't eaten today yet. So it really wasn't that big of a deal. I did tell my mother though, when I finish with this thing, I'm going to eat something and it's going to be really ravenous and crazy because I was just so excited that I could eat. But, so I ate after my procedure. Because they put you to sleep, it was over in 2 seconds. I woke up and no pain whatsoever. Yes, I was going to the bathroom all Sunday night, but that's what they want.
Yes.
They were like, "Are you cleaned out?" I said, "There is nothing left."
Good.
Nothing left.
That's what we love to hear.
And because I drink so much water, it was awful that I couldn't drink my water when I woke up. But I'm like, okay, I will be able to drink my water when this is over. Let me get my water bottle ready. And so that was that. And they were very nice. Everyone explained everything. Because I have asthma, the anesthesiologist was like, and I have food allergies. He was like, there has been some study. He handed me the paperwork and everything to read it. I said, I trust you. I've had propofol before. I'll be fine. Those that don't know, propofol is what Michael Jackson, unfortunately, had way too much of. But I had my propofol. I was like, I'll be okay. I've had it before. I'll be okay. He's like, okay, great. And sure enough, I was fine. Woke up. They explained everything. She actually handed me the report, which I was like, this is like the bomb. No other physician does this. She said, we will send it to your doctor, but here is your copy. And that wasn't because I was a doctor, you guys. This is
everybody
handed me the report
in color.
Yes. And she explained everything. Do you have any questions? No. And, it was great. Like after I came, I was on the, bed still. She's talked to me then, but then I went in office, sat down with her. We talked, went over it. She said, you don't have to come back for 10 years. And that was that. It was not a big deal. And let me tell you guys, another thing I told Dr. Janese, I lost 5 pounds in that 24 hours. I was like, and I am a very regular person, but I was just like, okay, we're just flushing. Okay. And it was not that big of a deal. And yes, we see the commercial for Cologuard. I think every day that commercial comes on. But you guys, we as a people, if you look like me, as Dr. Janese said, we cousins. And as all of my family, I need you all to go get the colonoscopy and don't get the Cologuard. Just go get the colonoscopy, because if they find something in Cologuard, you're going to have to go get the colonoscopy anyway. And not to mention, who wants to sit there? Before I was a doctor, I worked in an OBGYN's office, and that's when Cologuard just came out. And do you know people was mailing us they poop? Because they didn't read the directions.
Mm-hmm.
At least 2, 3 a week. Mm-hmm. It was awful. Awful. You're right. Rub your nose, Gwen, because it was stinky. It was nasty. And I was like, oh my God. So you do not want to deal with all that, you guys. You don't have to go in the toilet and touch your poop. You don't even have to do that. No. Just colonoscopy. And then let me tell you, because I'm so smart, I applied for not one, but 2 studies with my colonoscopies. I was like, if I'm going to get it done, I might as well get it paid to get it done. I ended up making $350, $400, I think.
That's awesome.
Yeah. And yes, and for that, I did have to send them a collection, but I was like, whatever. It, like I said, I got paid. So
Whatever.
if I'm gonna do it, I might as well. But so it's not that bad, you guys. Don't worry about what everybody's. It's not that bad. And literally, there are different kinds of preps. Mine's, like I said, it didn't taste good, but it wasn't that horrible. There are powder preps. And have you heard about this pill? I know you have.
I have. I heard about it, and I haven't used it on a patient, so I don't know how well it gets you clean. But yeah, I heard it's pretty effective though, and patients also know, like, if you feel like if you're a person who has nausea and you don't do well with sort of taste, and just tell your doctor. So there's options. There's not just, most people will stick to one prep. So some centers will all do the same thing. But if I have a patient that I know has baseline nausea or didn't do well with the prep before, or didn't get clean before, there's so many preps, and we'll just order another one.
Take the lemon flavor. I didn't have an option for flavor, and it really didn't have. It wasn't a flavor anyway. It was just whatever it was. But I will say that did you see Red Table Talk where they talked about this? And Jada did not complete her prep. And her mother told her.
And I was going to just say to that. So people say, you think you just can't deal with it. You're going to come in. And so everybody thinks, oh my God, you're a gastroenterologist. That must be terrible. And I'm like, no, the colon is pristine by the time I go in there. It's beautiful. There's no poop left. And if there is, you have to go right back home and try this again. Because the entire point of the procedure is for us to be able to see the entire colon. If we cannot see the polyp, the colon, because in small polyps, the whole point, I take out tiny polyps. I don't care if it's 3 millimeters. I'm taking it out. That's a point, because I don't want it to become something large, right? And so I got to be able to see to do that. And so I can tell when people have snuck and ate. I'm like, you can't sneak from us. This is a high definition camera. Things that I take pictures of with this scope look like they're massive, and they're tiny when we take them out. They're not big. And so I see everything. So I take a picture of them, like, guys in the room, what do we think this is? What did they have? Is that corn? Is that spinach? What do we think? Is it chicken? What did they eat? We take a nice picture of it, because everybody swears. I say the same thing as you. I couldn't possibly have anything else. I couldn't possibly. I'm like, you do not understand how much poop is in your colon. A lot. Right. You need that massive prep to clean you out. So if you're not clean, we can't. It was a waste of time. Exactly. That means we've given you anesthesia for nothing. We couldn't see it. And so we send you back out and say, listen, I can say I didn't see anything, but I can also tell you I didn't see your whole colon because there was poop left in there. So then you have to come back and do the whole thing all over again. So when I tell people in clinic, I'm like, listen, you want to be one and done, right? You want us to be able to come back in 3, 5, 10 years, right? Just take the prep. Just drink the whole thing. Do not eat, just even a little bit. It's your mind telling you can't eat this stuff, that you're so hungry. You're not that hungry. Okay. You're not that hungry. It's mine. Trust me, you can handle it.
It's only a day. I mean,
it's a day.
Not that awful. It was a day.
One day for you to prevent colon cancer. One day, right? To get you completely clean. And so once I explain it that way, is that we're not going to be able to see. And then some people will still do it. Either they forgot or something, or they just could. They just say they couldn't do it, And then we take a picture, and I just take a picture of what I saw. And then I'm like, oh yeah, that was a lot still left in there. I'm like, this is what I saw. I'm not lying to you. Here you go. That's why I love those pictures, because the pictures don't lie. So just take the prep, guys.
Those polyps, you guys, that's what turns into cancer, which is why she is kind enough to remove even the smallest of ones, because you don't want anything left behind. You want it all out so it has no potential to grow into anything. So Gwen, how often do you have to have colonoscopies now?
So I had one 6 months after my surgery, after everything was healed up. Yep. And so he gave me, it's now
should be 1 year after that.
And so I was trying to remember, I was like, so it'll be a year, because I go see him next month. And so then after that we'll see, but right now it's a year.
Okay. Yeah.
So the routine is 6 months after surgery, and then you do a year after that. And then usually if all is well, you can stretch it out to 3 years after that. So that's sort of typical.
Mm-hmm. And what is there a probability for it to come back?
So after now that doesn't mean that she won't be susceptible to have other additional polyps. So that's why they're doing it. And that's why your screening will probably be less, because once you have a history, she'll never go to like every 10 years, right? So, a person who has no family history, because we know there's a propensity. That's the same thing in a person that I see that I take out polyps. And guys, polyps are just they look like little bumps. They look like little circles that we see in the colon when they're small. And we send them to our pathologist to give us exactly what type they are, right? And that tells us what your risk is. And so if you're a person who's had polyps before or has a family history of polyps or anything like that, that tells us that you will not be like Dr. Renee and come back in 10 years. You will be a person that comes back in 3 or 5 years, depending on how many polyps you had and how many they were. So if somebody just has one polyp that, wasn't so big, they get to come back in 5 years. Somebody has, 5 polyps that were all sort of medium sized, they got to come back in 3 years. Somebody has over 10 polyps or polyps over, a centimeter, they come back in 1 year. And we base it sort of on how many you have, because once you start to grow polyps, we know that there's an increased risk for you to have them again in the future. So that's why it's important. So when I have somebody that wakes up, we do the same thing. I show you pictures of the polyps we took out before they were gone. We tell you sort of, I can usually tell you what I think they are based on it, because like I said, sometimes I know some of them are going to be sort of benign, which are not precancerous, but we take them out anyway, because I'm not, my eyes don't have pathology, X-ray vision. So we take them out anyway. But I can tell patients by the time they wake up, it's probably going to be, 3 to 5 years based on the pathology. And that'll be sort of, if some of these are benign and some of them are precancerous, that's how we know. And then you get a letter in the mail telling you, all right, this is when you're going to come back.
Yeah. So, I mean, you guys, please, it's just not that bad. And, greens, collard greens are a good source of fiber. Mm-hmm. But as I've mentioned before, please don't cook them till the water is green. Please don't do that. I mean, honestly, you could saute them in a pan with grapeseed oil, olive oil or something, but don't cook them till the water is green, because then don't cook any vegetable till the water is green. They are no good. You've cooked all the nutrients into the water.
For sure.
So don't do that. Don't do it. I know that Big Mama said you got to cook them all day. You really don't. Yeah. Unless you're in a slow cooker that has about this much water in it, then that's something different. Yes. But if you are cooking on the stove all day, no, that's unnecessary and it's not helping you. So there's delicious foods that contain fiber. So let's just incorporate them in our diet.
Exactly.
And so we can prevent all of these people dying so early from colon cancer. And please, wives, girlfriends, whatever, because men have trouble for whatever reason going to the doctor, make sure you make their appointment and drive them to, because the other thing about colonoscopy, you cannot drive yourself. You need someone to drive you, because you are heavily sedated. You can't drive a car afterwards. So therefore you have to have someone take you and pick you up or stay and wait. It's not long, so it's not a long wait.
Takes 20 minutes to do patients can't believe it. I tell them, by the time you wake up, you will be asking me, are you going to get started yet? And we are already done. And that's typically, they're like, oh my God, that quick? I don't even remember going to sleep. Like, that's how we like it. And I think another thing is it's so much stigma. Like, even my dad was late getting his colonoscopy. And I said, you know what? You're going to make me look and that's exactly what I told him. You're going to make me look like the world's worst daughter if you have colon cancer. Are you kidding me right now? And that's ended up how I guilted him. But I think our men in particular, it's something about, is the stigma about, something in your backside. What am I going to feel like afterwards? You feel like nothing afterwards. You feel absolutely nothing. It is, you will feel nothing. And trust me, the other thing I had to tell my dad was, no one cares. Do you know how many colons that we're doing a day? No one is looking at yours as the special one. Okay. The special bottom. My dad was very concerned that his bottom was very, very special. So I had to let him know it was really not. And no one wanted it but my mother, no one else. Okay? Right. And so that's the other funny part. And so I think it's getting people over that stigma. And I'll have guys to look at my fingers. And I'm like, what does that have to do with anything?
My God.
Mm-hmm. Yeah. And I'm like, that has literally nothing to do with this procedure at all. It doesn't matter if I have massive hands or really, really tiny hands. It doesn't matter. It is, a scope that we're using to take out polyps, and you are asleep. You do not feel or remember anything. No one is looking at any other part of your body. I promise you. No one is judging you. I've had women to say, "Oh my God, I forgot I didn't shave my legs." I am not looking at your legs. I am not looking at your nails, your toenails. I've had people apologize for their toes. We are not looking at any of that stuff, people. There have been like 16 people ahead of you. You know what I mean? Like throughout that whole day, it is, we are looking for polyps. That is the only thing my eyes are looking for on that screen. And everybody in that room, everybody is in that room. That's what we care about. We are not paying attention to anything else. So please don't have any of those worries that anybody's judging you for anything, anybody's doing anything weird to you while you're asleep. Nope, we are making sure you are covered. The only thing that is out is enough room for me to look in and look at that scope, and no one is looking at it,
Right.
So just so you know, it is, no one's doing anything weird. We are looking for polyps, and that is the whole point. And it is easy. You do not feel anything. There's certain different ways to do sedations in certain places. Just ask them how they're going to do yours, but you can't somebody has to take you home. But you don't feel or remember anything, and it's so quick. I tell patients, the worst part is the day before, and it's really just a mind thing of saying, you know what, I got to do this once. It's not a big deal. It's just like, you have many things that we have to do, for your health. Nobody likes getting their blood drawn. It's not like the ideal thing in the world. But it's, it's over before you know it. And it's the same thing with a colonoscopy. It saves you that risk.
Colonoscopy is your sleep.
Sleep. It's perfect.
Your sleep. You don't
done
even.
And done.
And then
time you know it.
Say, I know my OBGYN, she does a guaiac, and that's what it's called, right?
Mm-hmm.
Yeah. And so that is when she does stick her fingers in your rectum to check to see if there is blood in your stool. They put a little chemical on a card or whatever. Hopefully your doctor is doing that. And if your doctor is not doing that, you might suggest that just so that in case something comes up and you're only 33, 32, 31, it could be caught then. Well, they could catch something then and then send you on for your colonoscopy. So that's another thing that could help you, preventative measure. But I wanted Gwen to please sing her song before we get out. And Dr. Janese, this has been fabulous. We must have you on again.
I loved it. Thank you for having me.
But Dr. You got to hear the song. Go on, Gwen.
Okay.
Oh God! Now you put me on the spot. So she's talking about on Family Feud, yeah. So I had Steve dancing to "Get Your Booty Check, Get Your Booty Check, Get Your Booty Check."
I love it. Love it.
Thank you so much, ladies. This has been so much fun, and I cannot wait. Like I said, might have to both of you on again. But thank you so much, and everyone, please share this broadcast because this is something we can help. We can do something about this. So let's share this broadcast, and I will see you guys later next week. Bye. Next week is Kidney Cancer Awareness Month, so we have a patient and we have a physician. It's going to be amazing. I will see you.